All right, let's shift focus now to COVID-19 and to Russia, where more than 124,000 people have tested positive for novel coronavirus. 1,222 people have lost their lives, and in the last 24 hours, the country has reported 9,623 new cases. This marks a new one-day record increase. The rising number of cases has put Russia on the 7th position in the list of countries which are the worst affected. The number of positive cases in the country has surpassed the cases recorded in Iran and China. However, Russia has reported only 1,222 deaths, and the low number of deaths and increasing number of positive cases has raised various questions as well. And Julia Chapman is now joining us live from Moscow for the very latest on what exactly has happened in Russia. Julia, a massive surge there in the numbers in the last 24 hours, 9,600. What is the reason behind the spike?
Well, Russia and Russian officials say that is because they are testing so widely that the numbers have jumped significantly. In the last couple of weeks, we've seen a pretty steady rise, around 6,000 new cases every day. But today, as you say, has been a very big jump, nearly 10,000 cases reported overnight. But the death toll, the daily death toll, has dropped somewhat. That's gone down to 53 in the last 24 hours. And it's very interesting that the number of deaths comparatively to the number of cases in Russia is quite low. And Russian officials say that is because they have tested so widely that they are getting to grips with the situation better than other countries who haven't been testing as widely. Russia says it has carried out nearly 4 million tests for COVID-19, although some of those will have been repeat tests, more than one test for a patient. But the situation is certainly getting worse here. The mayor of Moscow, Sergei Sobyanin, who is also the head of Russia's coronavirus task force, has said that nearly half of the patients that are in a serious condition in hospital have in fact tested negative for coronavirus, which suggests that there are serious issues with the testing process. He's also said that around 2% of people in Moscow have coronavirus. If that is true, that means the number is actually 5 times higher than the official figures suggest.
Right. And Julia, of course, the Prime Minister himself has been infected with COVID-19, while many doctors are not convinced with the official data on the medical staff and the numbers they say are much higher than what the government is saying.
That's right. Doctors in Russia have come up with their own list of their colleagues who they believe have died from COVID-19. That number is around 70 at the moment, but the official tally from the government hasn't been released. We have learned about a handful of deaths of medical staff in St. Petersburg, but other than that, there has been scant information about how widely this is affecting the medical community. Although we have heard from the Russian health regulator that around 20% of medical staff in Moscow have been affected by coronavirus, which is a huge proportion. And if so, that would make up a big number of the overall number of cases. But as we're learning, also Prime Minister Mikhail Mishustin has been diagnosed with coronavirus. He was diagnosed on Thursday. He is now in hospital for treatment. He's already been self-isolating like most members of the Russian government. President Putin hasn't seen him in around a month. But now that the disease has reached the very highest levels of the Russian government, it's certainly something that the government is considering very serious at the moment.
Right. And also tell us a little bit about, there are reports that certain hotels are now providing refuge for doctors who are unable to, of course, go back home because there's a danger of infecting family members as well.
There are some doctors who have been trying to avoid their family members. Of course, medical staff are at the front lines of this outbreak, and they are trying their best to protect both themselves, their patients, and other people that they come into contact, not least their family members. And there have been a number of hospitals around Russia that have had to come into quarantine themselves because there have been outbreaks at hospitals. This is a phenomenon that we've been seeing around the world, where hospitals themselves become vectors for spreading the disease. It's very difficult to contain, and medical staff have been widely affected. As I mentioned, around 20% of medical workers in Moscow have been affected by coronavirus. So this is an area of big concern here in Russia. But the hospital system, officials say, is more or less prepared, particularly here in the capital, less so outside in the regions where there are very varying degrees of quality of healthcare. But here in Moscow, there have been makeshift hospitals set up to accommodate the rising number of patients who are requiring medical assistance and hospitalization. But there are still big concerns that doctors could infect patients and others.
Right. And also very briefly then, Julia, what is the situation of the 10 million migrant population in Russia? We believe that they've been hugely impacted by this as well.
Well, they've certainly been impacted in terms of employment because it's been very difficult for them to earn money. There are millions of migrant workers here in Russia, most of them coming from the Central Asian countries. And they live and work here, and it's been very difficult over the last few weeks with Moscow and many other parts of Russia effectively under lockdown, preventing most work from happening. Of course, a number of them will be employed as couriers. That work is still carrying on. In fact, if anything, it's risen in the last weeks. So there have been more food deliveries to people's homes rather than them going out to get it at supermarkets. But there are big populations of migrant workers who are unable to work. They are living in precarious accommodation. And there are big concerns that they could, if infected, spread among each other because they live in very close quarters. And they are unable to travel home. Either they don't have the means or the borders have been shut. It's very difficult for them to get back. So this is another big area of concern here in Russia.
All right, Julia Chapman, thanks very much indeed for joining us and sharing all that information about what exactly is happening there in Russia.